Good evening. Hi everyone. It's Fertility Talk Live. It's Wednesday evening, 8 o'clock, and it's time for Fertility Talk. So today we are talking to Dr. Jo Pottow, and we're just gonna give everyone a few minutes to get on board online. And I see you there. Hi Jo, I see you. So we're talking about Papsmears and fertility check. The reason why it's important something to talk about is because a lot of women are under the impression if they go to a clinic and they go and have a Papsmear and the Papsmear comes back and it's clear, it's fine. You know, it's fine, which means I can conceive. So we're going to talk about that with Dr. Pottow, and she's going to give her input on that, and obviously a professional input on that. So I'm just going to wait for, I think I'll go live now. I'm going to invite Dr. Okay, here we go. Hi, Dr. Pottow. How are you?
Hello, good evening, Leanne. How are you?
I'm good, thank you. I just made it. We had load shedding, so I was sitting in the dark. Yeah. So, yeah, you know, that's what we've got to do.
Exactly. Work
South Africa
around the load shedding timetables.
Yeah, and I'm sure a lot of people that's online from other countries were like, what is this load shedding you're talking about? Everyone was saying, oh, good load shedding.
Exactly. Exactly. Another South African something.
Yeah. So we're talking about Pap smears, and the reason why I was just saying while we're talking about it because I'm always getting that messages and that emails, and I mean I've showed you as well about what Pap smear, what has a Pap smear got to do with your fertility, and women are under the impression that, you know, if the Pap smear comes back and it's fine, which means they are fertile and they'll be able to conceive immediately, there shouldn't be anything wrong, and we're trying to break that. You know, we're trying to educate women more around that, you know, that's not it. There is something else. Go and have yourself checked why you're not conceiving. So we're going to get right into it. But before we do, can we please just, if you could just introduce yourself to everyone, let them know who you are, where you're from.
Sure. Well, good evening, everyone, and thank you for joining. My name is Dr. Jo Pottow. I am a fertility specialist at Cape Fertility Clinic, well, Cape Fertility. Our clinic is in Claremont, opposite Kingsbury Hospital in Cape Town. So that's where I'm based. But I think that's the one thing about post-COVID, the world has become smaller. We're available on Zoom, so you don't even have to be in Cape Town to get one of our opinions, or if you want to chat, set up a consultation, we're happy to do it over Zoom as well. So you don't even need to be in Cape Town to see us.
That's awesome. That's great news, Doctor. So we're going to be talking about Pap smears versus fertility and fertility checks. And the first question is, what is a Pap smear and how is it performed?
Okay, perfect. So I think we must give Pap smears credit where credit's due. Everyone's heard of a Pap smear. And if you're not from South Africa, if you're from Central Africa, they call it a Papa Nicolau. That is actually the name of the test that it was named after. So if you think of it, everyone's heard of it. And so it's gained a lot of popularity, which is great. The reason is, it's a screening tool for checking to see if there are early signs of cancer in the mouth of the womb. It is very, very specific for what it is looking for. So I brought along some little models tonight because I thought, you know, the thing is to try and describe something is quite difficult. We need to know what our anatomy is. And when you go to your gynae or your GP and you have a Pap smear, what are you doing? So ultimately, this is a uterus. And here it's just a muscle. This is showing you pathology, so please just ignore that. And on either side of your uterus, you have tubes. So a tube on either side and 2 ovaries. So that's basically what we have. So what is a Pap smear doing? Well, a Pap smear is looking here. This is the mouth of the womb, the cervix. That is what we make reference to as the cervix. And we are literally putting in a speculum. Everyone's heard of that word. It's that silver contraption that goes in,
Yeah.
and just gently, meant to be very gentle, hold the side walls of the vagina open, so that when we're looking inside, we can actually see that cervix. So that is the entrance of the uterus. Literally, you can take their different instruments that you can use, but we are literally touching, just slightly touching that cervix to pick up some cells, for them to take the cells and look under the microscope and see, is it normal cells, or are they showing signs of changes which are early signs of becoming cancer? So that's why we call it a screening test, because we know cancer that involves the mouth of the womb, the cervix, is generally a slow-growing cancer, and it's something we can pick up early, treat completely, not cancer therapies like chemotherapy and radiation. Yes, unfortunately, if you've already got cancer, that's how we treat it, but we're hoping you never get cancer. So it's much like checking your blood pressure. You don't want to have a stroke one day. So if you check your blood pressure, you keep your blood pressure controlled, the chances of having a stroke are significantly reduced. Same here. We don't want you to get cervical cancer. It's a treatable thing that we don't need you to get. Bless you, bless you.
Thank you.
So that's all a pap smear is. So it's great that we've all heard about it, but people have this misconception or this notion of, well, if I've had a pap smear, I've checked everything. And I think that's why it's important to see what we're checking. We're checking a tiny few cells that are sitting here at the entrance of the cervix. That is all we are looking at. We are not doing any other test. So it's a powerful tool, but it's a powerful tool for what it's looking for. And that is early signs of a potential cancer.
Awesome. Does an all clear pap smear result indicate I'm fertile?
So that's exactly it. I mean, yeah, and you and I had that conversation. So many people say, I've gone to my gynae or I've gone to my GP, I've had a pap smear, and they say I'm fine.
Yeah.
You are. That's wonderful. It means your pap smear, you have no abnormal cells which can become cancer. But that's got no reference to your fertility whatsoever. Your fertility, firstly, fertility is always looked at in the context of two individuals, because generally we need eggs and sperm. So it's both gametes. But if we're looking at just purely from a female perspective, this is where your eggs are housed. You are born with them. You have no way of making eggs. And so that's why we call it the biological clock. This is literally just the basket of eggs that you are born with. We lose every month. And once the basket is finished, there's your fertility gone. So that is for every single woman, and it's age related. That's why we know as the time goes by, your eggs are up. But it's not only an egg we need. We need healthy tubes, because that's where the sperm and egg meet. So we need a nice healthy tube, not a damaged tube. So are your tubes open? That's a very big fertility question. And then last but certainly not least, inside the uterus, you need a normal uterus so that baby's got somewhere to grow. You might have had an egg, it went into a normal tube, met the sperm, made the baby, moved down, came into the uterus, but now it's fighting with humps and bumps and growths such as fibroids, polyps, other things, septums, a whole bunch of things that can happen inside your uterus. So when somebody wants to know, what's my fertility like? Where do I stand from a fertility point of view? You want to see that there's nothing inside the cavity of the uterus, that a baby can adequately grow there, that your tubes are open, and that you have eggs and you are ovulating an egg every month to give you that chance of conception. So when you look at fertility and you want an answer, if you haven't checked your tubes, if you haven't had a detailed look inside the uterus, Somebody merely just having a look at the tip of the cervix, they're not telling you anything about your fertility. Yes, it's an important thing to have a normal pap smear when you fall pregnant. The last thing we want is to find cervical cancer halfway through your pregnancy. That's a disaster.
Yeah.
So, of course, general health screening, making sure that when you are ready to have a baby, you're going to go and make sure that your pap smear is normal, so that it's one less thing to worry about. But saying it's a normal pap smear hasn't given you any insight into your fertility ability.
So that's such a great way of explaining everything. Thank you so much for that. I'm glad you brought your friend with you.
Yes. I can't seem to describe anything without it, you know.
I think that's today.
Sorry, no.
The same?
I even
thought you said something else.
other pictures. I thought, you know what, if my model wasn't working, we were going to get really up close and personal and have some pictures of exactly what's going on. But the point is, you know, the thing is that all of us hear these things, but it's about putting it into perspective and knowing. I don't expect anyone to know this. And I can completely see how one could go to a medical professional. The person is not misleading you. They're saying everything's fine. But they're giving you a report back on what they've done. Unless you have gone and specifically said, I'm worried about my fertility and I want to check where I'm at. What can I do? That's when somebody's going to say, well, we need eggs, we need clear tubes, and we need a good uterus. And even if those are all perfect, it's still not a guarantee that you won't have a fertility issue. I think that's the biggest conundrum with fertility, in that you actually don't know until you're trying. Yeah. But it's very reassuring knowing that your ovaries are behaving themselves. They're ovulating every month. That your tubes don't appear damaged on an ultrasound. So I'm not saying you must now go for all this extensive fertility assessments and spend unnecessary money or expose yourself to potential workup that you don't need. Yeah. If your tubes look beautiful on an ultrasound, we are not meant to see your tubes. So if I can see a tube and it's damaged and swollen, there are alarm bells that are going off in my head. And now I would say, gosh, it appears that one of your tubes is damaged and we need to check and give and do a tube test, which is their ways of doing it. But you can see how it's directed. It's not that if you, that you need to, everyone who's trying to conceive needs to go and do an HSG. You don't have to. You're first going to try and conceive. And if you aren't managing to, that's when we step it up, if that makes sense.
Okay. I'm glad you said you should actually go and tell a doctor, not just, oh, I'm coming to check if everything is fine, and actually say, I want to check if my fertility is okay. Can you please check everything because I'm trying to conceive? Yes. You know, mention that and not just go there and I'm coming for a checkup. Yes. And she's going to say everything is fine. Because that's the
point is, that's it. They're going to look at your uterus. They're just going to make sure that there's no humps and bumps and growths. They're going to do a pap smear to make sure that you don't have any abnormal cells that can become cancer, just in a very specific area. And then they're going to say, well, there we go. Everything's fine. You're under the misconception that, oh, hang on, I'm fertile. Yeah. And I think Dr. Oosthuizen and Dr. Liesel Oosthuizen, we worked together at Cape Fertility. We were talking about it.
He's actually on watching, I think. I saw it come up.
Wonderful. We were talking about it and we were saying, that's the problem. Everyone has an assessment, but it's what are you assessing to be able to make that, are you checking fertility or are you going to your gynae? Because that is their job, is to make sure that you don't get cervical cancer. It's a treatable thing. That's exactly why you're going. And it's a very important step. But I think you need to know what you're testing so that you know what you have. Unfortunately, or fortunately, I don't know which way to look at it. A pap smear, completely different, nothing to do with your fertility.
Okay, so what is a okay? So I think we've actually gone through what does a pap smear and fertility check have to do with each other. We've actually gone through
Yeah.
that now.
Yes.
But how do you check? How does one check if you are fertile and the test that gets performed?
So I think the thing is that's, you know, one of the problems. It's never just one person with fertility.
Yeah.
You have to look at the situation of how. The biggest thing that you can say to anybody, because we know this is the question we get all the time. I'm not in a relationship, or I'm not ready for a baby, but I just want to make sure that my fertility is okay. Well, the first thing we're always going to say is age of a woman is the thing that gives you the ability. It's the biological clock. So you can be the fittest, healthiest, with the most beautiful looking uterus with wide open, beautiful tubes. But if you're 44, you have a very, very, very low chance of a natural conception because your eggs are 44 years old, and the chance of conception is exceptionally low. So it's age related. So when somebody wants to know, what's my chance of fertility? Ask yourself, how old are you? Because we know that egg quality declines at a certain age. So technically, anything under 35, you've probably, unless, you know, your tubes have been damaged or you've got fibroids or something, which we can see on an ultrasound, technically your fertility should be in a good state, if I can say that, to do a wide, broad statement like that. Because the last thing we want to do is make a whole bunch of people that are healthy and well panicking about their fertility. But I think it's knowing the facts. A lot of women come in and say, I'm 39 years old, I've just got married, and I want to have a baby. And you don't realize that actually 39 is not old. I'm not saying it's old at all. But in comparison to 300 years ago, when people used to have babies, they were having babies 19, 20. That's when our eggs are wonderful. And they're wonderful to 27. And from 27 years of age, they slowly decline up until 37, where then the graph nosedives down to 42. And that's every woman. So to go and do extensive fertility tests is, I think, unwarranted when you're not trying. Going to your gynae, making sure your pap smear is normal from a screening point of view, making sure you don't have fibroids inside your uterus or polyps, abnormal bleeding. But these things don't generally just pop up. You would have signs and symptoms. You would have abnormal bleeding. There would be a reason why you would be going to your gynae. And just because you've got those things, fibroids, polyps, it doesn't mean your fertility is compromised. It depends where they are and how much they are impacting. So I don't want people to also get the feeling that, oh, I've got a fibroid. Does that mean I've got a fertility issue? No, not necessarily. Somebody needs to put it into perspective for you and do an ultrasound, take a history, and they will be able to give you a good guide as to where you are from a fertility point of view. But with women, it starts with age.
Okay. And then our last question is, does your partner also need to be tested? And yes, you touched on that a bit, but maybe you could just go through that as well, and, you know, the partner's side of all of it.
Sure.
The husband.
So I think from our perspective, the reason why we can say from a woman and it's a biological clock is we are born with these eggs. With men, they make sperm every day. It's fresh, it's new. They're not born with their sperm. They're born with the machinery to make the sperm, if that makes sense. So the thing is that you can look at a nice, healthy, well-built, young chap and say, gosh, you must have great sperm. The problem is you can never make that assessment until you're actually looking at the sperm under the microscope. Now, if there hasn't been any history to suggest if they didn't have mumps as a child, if they weren't, if they were born with an undescended testy and it had to be corrected, those are little clues that maybe there could be an issue, but not necessarily. You can have mumps as a child and your sperm can be fine. The point is That's why we would take a history to say, should we do a semen analysis? But, you know, to rush out when you get married, you haven't even, or you in a relationship and you're going to try and start having a baby, you don't need to send your partner straight away for a semen analysis. Let nature take it, give it 6 months. If there are no abnormalities, that you aren't seeing any issues, leave it, try for 6 months. And then afterwards, if you haven't conceived, that's a good idea to say, well, let's go and do some investigations. But as women typically do, they arrive on their own and they say, I can't conceive. And the point is, that's not true. There are two of you. Yeah. And so at that consultation, while we're looking at the uterus and we're looking at your egg levels and we're doing blood tests, we need a semen analysis to be able to say, is there sperm? Is there enough sperm? Does it swim in the right direction? And is that normal? And the good news is it's a simple semen analysis that can give us those results. So yes, that's the long answer of yes, we definitely need to check your partner.
Awesome. Thank you very much, Doctor. Is there anything in closing that you want to say to us or give any advice to the women that are watching and trying to conceive?
I think, well, just as a general broad statement, don't give up. I know it's such a difficult, tough road, but the point is make sure that you've surrounded yourself with the right team of people, that you're getting the right advice. Reassuring, kind-hearted family members saying, oh, don't worry, it'll happen one day, is wonderful from an emotional support point of view, but arm yourself with the facts. Go and see somebody. Let them give you the information so that you know what you're dealing with and that it feels a little bit contained and you've got a plan that you're working towards.
Yeah.
At Cape Fertility, there are 5 of us doctors that are there. We are always willing to help anyone, just even sometimes that first consultation, just to reassure you, to see where you're at, rather get that information to help you, you know, so that you know, don't do this alone. And I promise it won't be long. One day you will be one of those people that will be like, whew, I fought through and I got what I wanted.
Yeah, awesome. Awesome. If you can just give your details of how they can contact you, if anyone wanting to contact you.
Sure. So our website, Cape Fertility, www.capefertility.co.za. Even if you just type into Google Cape Fertility, our website will come up there. All 5 of us doctors are there. You can just click and speak to one of us directly. Otherwise, if you say, well, I'm not quite sure, no problem. You can contact our secretaries. The number is there. Phone, make an appointment and come and see us. The point is, we're going to see you quickly, get you pregnant, send you back to your gynae, so it's a happy, nice rest of the pregnancy.
Awesome. Thank you very much. Thanks for taking time out to come and talk to us and give us this very important talk with regarding to pap smears and fertility. And we hope to see you soon in the next month or 2.
Perfect.
Okay.
Thank you, Leanne, so much. Thank you for putting this together. It's exceptionally informative for everybody, so thank you.
Awesome. Thank you, Doctor. Have a great evening.
Bye.
Bye.